Hey, what are your health insurance costs going to be in retirement? Your health insurance, your medical costs. It's a very important question because it's probably going to be one of your largest retirement expenses. And not only that, but it can help you early on decide how much you should be saving in the retiree health account. Should be minimizing RHA spillover, a lot of things to take into account there. So that's what I'm talking about in this video, is what health insurance and medical costs are in retirement. This is the third video in a series I'm doing about medical retirement planning. And the first one was about Medicare basics, and then the second one was about covering what United covers as far as their insurance and how they supplement Medicare. So this one, we're getting into healthcare costs, what you're looking at as far as cost goes. And then the one after this is going to be utilizing the RHA, how long the RHA lasts, and so on and so forth. So if you haven't done it yet, remember to subscribe and hit the bell icon so that you get notified when all these new videos come out. And then also down below in my previous two videos, I have put some cheat sheets and some checklists down there that will help you navigate your health insurance decisions and costs and financial planning in retirement. So I got the same links down in the show notes on YouTube for this same video. So go ahead and click on those and download those. I think those will really help you out. Other than that, hey, I'm Dan Lomar, CFP professional with United Wealth Management, where we specialize in PREP management and financial planning for pilots at United Airlines. And like many of you, my business partner, Alan Bewley, and I are both pilots for United. Welcome to another video. Thanks for tuning in. And for all of you other pilots out there who've commented on my videos and give me some really positive feedback, thank you very much for that. And like I said, let's just jump into it, and I'll show you what we got going here. And like I said, the next video is going to be about how long your RHA lasts. Right now, we're talking about what your healthcare costs are going to be, what the categories are, what types of costs, and then how much they'll actually be. When I do a plan, I start out by looking at the current RHA balance, okay? Because, and I also look at costs that are specific to the individual, because some people will have TRICARE, some won't have TRICARE, some will have long-term care insurance, some won't, some want to self-fund long-term care. So there's a lot of different variables, and it isn't all the same. So that's one of the points of this video, is that I'm not here to tell you what your costs are going to be. It's just more to give you an outline and some things to think about how you can determine what your costs are going to be, and think about those ahead of time. So when I look at a plan, I look at all these things, and then it helps me determine, what RHA spillover, should you minimize it? Should you maximize it? Long-term care insurance, can you afford to buy it and pay for it out of the retiree health account? And then also some long-term projections on the RHA. And that's why it's all these things are all reasons why it's really important to really know ahead of time what your healthcare costs are going to be. The numbers I'm using in these examples are 2021 numbers. Obviously, they're going to change from year to year, and this is for educational purposes only. So, like I said, I'm not here to tell you what yours are going to be, but just to kind of create a model so that you can use some assumptions and kind of look into it for yourself. There was a Fidelity study came out. It's called How to Plan for Rising Healthcare Costs. There's a link. I'll have that link in the show notes on YouTube. And basically what they said was a couple retiring at age 65 in 2021 may need $300,000 after taxes to cover healthcare expenses in retirement. And that's probably for about a 25 to 30 year retirement period. And when I did my RHA analysis, I kind of came up with the same numbers, and I'll talk about those here also. And that does not include long-term care insurance or a long-term care event. That would significantly, at least for sure, a long-term care event would change things. So what costs are there? What are the different categories? Well, you got United Retiree Medical, you've got out-of-pocket expenses, you've got Medicare, and you've got long-term care expenses and or insurance. What about TRICARE? So, TRICARE significantly reduces your costs of medical insurance in retirement. But probably the point I want to make here is that even though you might have TRICARE, you can still underestimate or misestimate what your retirement costs are going to be. So that's really the more important thing here, is not that TRICARE takes care of everything, or it substantially lowers your costs, but that you can still underestimate or misestimate what your costs are going to be. I've heard people say, well, I don't need Medicare because I'm going to have TRICARE. Well, that's not true. You still need Medicare. Or I've heard people say, I don't need Medicare because I'm going to have United health insurance. Well, that's not true either. Medicare is the primary insurer, and so you're still going to have insurance costs besides Medicare. You're still going to have Medicare costs. And the other thing is TRICARE doesn't cover long-term care insurance or long-term care events. So that's just something there. So that, like I said, that's the main point, whether you have TRICARE or not, is just understanding that, hey, you can still underestimate or misestimate what your costs are going to be. These are the resources we use as far as where we get our numbers for planning, if just in case you wanted to see that. And then after Medicare retiree medical, probably the first category to take a look at. These are 2021 costs. United provides a $90 subsidy per person to help reduce that cost. And the plan I'm using here, just an example, is the Aetna Medicare Advantage ESA PPO. Probably the reason is because that's the plan that most United pilots are using when they go into retirement. In 2021, that's $186.84 per month per person. And so what that is for a couple is $4,484 per couple per year. And again, there are other plans out there. There are some HMOs. There's some other options, but this is the core plan, and this is what I believe most United pilots are going with. There are some out-of-pocket expenses. And again, so the resources we're using for planning numbers just say, hey, use an average of about a little over $1,000 per year per person for out-of-pocket costs, so almost $2,100 per year per couple. What are some of the out-of-pocket costs you're going to possibly run into? Deductibles, copays, non-covered expenses, dental, vision, things like that. And again, this is an average. It might be lower in the early part of retirement. It might be more than that in the later part of retirement. But again, for planning purposes, use a number. That's it. That's what we're using for that. Medicare costs. There is no cost to Part A because we've been paying that through payroll taxes through our entire working career. Part B has a base cost, and it also has surcharges based on your income. So Part B, the base cost is $148.50 per month per person. And then Part D varies by plan. If you're in a Medicare Advantage plan, a lot of times, not always, but a lot of times that it covers your prescription drugs coverage. And so that would be included in the premiums for the Medicare Advantage plan. And that's the way it is for the United Medicare Advantage ESA PPO. But and I'll talk about the surcharges here in just a second here. Yeah, so here it is. So Medicare surcharges. So this is called IRMA. It's called Income Related Monthly Adjustment Amount, and it's based on your modified adjusted gross income. And so what it is your Medicare charges a surcharge if your income is above certain thresholds. It's not just one threshold. There's several thresholds, and I'll show you here a couple here in just a minute. And it's a cliff. They call it the IRMA cliff because if you're $1 above that threshold, as far as your modified adjusted gross income, then you get charged the full IRMA charge. It applies to parts B and D. And so even if you're paying your Medicare Part D premiums as part of your Medicare Advantage plan, so in other words, you're not paying Part D directly, but you're paying it through a Medicare Advantage plan, you can still get charged this IRMA fee for Part D. But let's take a look at that here. Here's the pamphlet you can download. This is a great pamphlet. It's got all the costs in it for your different incomes and filing single, married, and what the different base costs are and the IRMA charges. I'll have that in that link in the show notes in YouTube. So here, let's take a look at this. And there's a couple really good things to point out here. First of all, you've got single costs and you've got joint costs. So that's kind of broken down here for a single person and for joint. And pretty much the income brackets for single people are pretty much half of what they are for joint couples filing jointly. So here's $188,000 that you have to make less than $188,000 for a single person to not be charged the IRMA amount, and under $176,000 for a couple. For the most part, for the plans I'm seeing, this is probably what the majority of United pilots are going to see for retirement. Under $176,000 modified adjusted gross income. It comes more into a factor when you're having to take out required minimum distributions, and that's where you can be forced into a higher income bracket. And there's some techniques you can use to kind of reduce your RMDs if that's going to be a factor. But here's, as we just kind of look across this, if you make below these two income amounts, then your basic cost, again, $148.50 per month, not including Part D. I'm not going to include that right now because, again, that's actually included in the Medicare Advantage ESA PPO. But if you look at it, it ends up being just for Part B for a couple, that ends up being $35.64 per couple. Now let's look at it for an individual. Gets very interesting because it can get actually much more. It can be a much higher cost than what you're anticipating if you're single. And this is the reason I point this out. This is the whole purpose of the video, is know what your costs are going to be. It is not unreasonable at all that a single United pilot is going to be in one of the higher income brackets as far as Medicare costs go. 138 to 165. Why is that? Well, because they've saved just as much, they've worked just as much, they have the same PBGC benefits as most joint couples, and most joint couples are going to be making, they're going to fall under this amount. It's not unreasonable at all that a single pilot retiring from United is going to be in one of the higher brackets, 138 to 165. So let's look and see what that does to your Medicare costs. You got the base cost of $148.50 per month, and your surcharges are more than the costs themselves. What's that come out to be? Well, if you come all the way here, $5,247 per year. So that's, in most cases, that's substantially higher than what I believe most people think they're going to pay as far as a single pilot. So the whole point of this is know what your costs are going to be, kind of what bracket you're going to expect to be in. And the sooner you're looking at this, the sooner you can do things to kind of reduce your required minimum distributions, or at least understand what your costs are going to be. Save more in the RHA, help you make better decisions early on as far as planning goes. Let's take a talk about long-term care coverage. It's another expense category. Most people, there's two ways to look at it. You can look at the cost of insurance, or you can look at the cost of the event itself. If you go with insurance, a long-term care insurance contract, a qualified long-term care insurance contract, can be paid from the RHA. What's qualified? Well, it does not have an annuity or a life insurance rider attached to the policy. And one thing I would recommend doing is, if you're considering doing this and you just want to make sure that it is a qualified contract, hey, just run it by your benefits resources and make sure. But for the most part, as long as it's a straight up long-term care insurance policy with no other life insurance or annuities attached to it, it's probably going to be a qualified contract. So what's a number I use? This varies quite a bit. Right now, just for the example I'm using $5,000 per year for a pooled benefit for a couple, $2,500 a year for a single person. This can change. This can be significantly different, because the older you are and the less healthy you are, the more expensive your premium is going to be. And then also, the earlier you buy it and the healthier you are, then let me back that up. The older you are and the less healthy you are, then obviously the more expensive it's going to be. And keep in mind too that long-term care insurance is actually harder to qualify for medically than life insurance a lot of times. And then also, then the cheaper it is, the younger you buy and the healthier you are, then the less it costs. So this cost can vary quite a bit, but I've just got in there as an example. And the thing I tell my clients all the time, just get your own quote. That's the best thing you can do. Because it varies so widely. Just get your own quote and make up your mind based on that. So let's add up these costs. Let's talk about what it's going to be for I've got here for a single person in the second IRMA bracket for Medicare. For medical costs, you're looking at almost $8,000 per year for planning purposes, and then for a couple, a little over $10,000 per year. So you can see here, for a single person, if you do end up in this second IRMA bracket right here, it could probably be a little bit more than what you're anticipating. Throw the cost of long-term care insurance policy in there. A single person is looking at over $10,000 per year for medical costs, and a couple is looking at possibly up to $15,000 per year for retiree medical costs. I inflate these numbers at 5.8%, and I use level long-term care insurance premiums. Those are the numbers and assumptions I use when doing RHA projections and how long these the RHA can last, and then also like what the expenses would be over time. So lifetime costs, what are we looking at a single person, just using the straight almost $8,000 a month, a 25-year lifetime, $220,000, and over a 30-year lifetime, $269,000. Again, that's no long-term care insurance and no long-term care events. And then for a couple, a little over $10,000 per year, you look at $277,000 up to almost $340,000. So somewhere right like that study said, right about $300,000. That is the total spending. So that is not necessarily what the amount it takes to fund that amount, because again, it depends on what the growth rate is of your investments or the RHA or whatever you're funding it with, and then also what the inflation is of the cost. So anyway, I hope that helps you, give you an idea. The whole point of this is estimate your own costs, what you think your costs are going to be ahead of time, and help you make some good decisions early on RHA funding, spillover, and so on and so forth like that. Because I think from the conversations I'm having and the comments I'm hearing, is I think a lot of people are underestimating what their health insurance costs are going to be. So that leads me to my next video, which is you probably don't have enough in your retiree health account. That's the next video. Hey, be sure to subscribe and hit the bell icon so that you know when those videos come out. And remember, down below, I've got a link down below that will take you to the cheat sheets and the checklist that I've had previously for the previous two videos. So go ahead and click on those and take you so you can download those links also. So, hey, I appreciate you tuning in. I appreciate your feedback. I'm Dan Lomar, a CFP professional with United Wealth Management, where we specialize in PR management and financial planning for pilots at United Airlines. And like many of you, I'm a pilot at United also. Hey, until next time, fly safe.